Medical terms are sometimes humorous and used to explain some hilarious medical scenario. Others are used to hide more offensive or derogatory statements. And then there is the distinct category of slang used to describe the condition of dying patients. Hide controversial medical procedures from their relatives or just refer to the annoying habits of loved ones. John Thomas sign. The John Thomas, JT or Throckmorton sign is a slang used by physicians to refer to the position of the penis in the X-ray scans of a man's pelvis. A patient has a positive John Thomas sign if his penis points in the direction of the injured body part and a negative John Thomas sign if it points in the opposite direction, some physicians believe. The position of the penis in X-ray scans is not always coincidental. For instance, men with hip fractures are likelier to have positive John Thomas signs. Physicians believe this is because patients with hip injuries often rest at an angle to avoid pain and discomfort, causing the penis to point towards the injured hip. Logical. Slow code. Doctors in training are often told, when you hear the sound of hooves, think horses, not zebras. The saying uses horses to refer to common diseases and zebras to refer to rarer diseases. The idea is that almost every human is likelier to see a horse than a zebra. Except maybe if you live somewhere in the African savanna or near some wildlife park. Rare and common diseases often have similar symptoms and a doctor could easily misdiagnose the symptoms of a common ailment is rare, so the saying encourages doctors to assume the symptoms are caused by the common disease and not the rarer disease, while the slang has probably saved millions from misdiagnosis. It has caused trouble for medical zebras, the slang for patients with rare diseases. Physicians often have a hard time diagnosing people with rare diseases. Medical zebras often visit several physicians and undergo many series of tests before the real cause of their symptoms is discovered. Frequent flyers. A frequent flyer is a patient who frequently reports to a hospital emergency room for non-emergency reasons. They often arrive the emergency room in ambulances or just walk straight in without any help. Frequent flyers visit the emergency room so often hospital staff know them by their names. Little wonder they are also called high utilizer, super utilizer or gomer, get out of my emergency room, which we will mention in the next entry. Some patients become frequent flyers because they do not have insurance and cannot afford a regular doctor visit. So they just go straight to the emergency room where they will always receive treatment. Some have insurance but just prefer to visit the emergency room for unclear reasons. However, the action of the frequent flyer is often costly. One study revealed frequent flyers formed 1% of the patients that visited hospitals in Camden, New Jersey. Yet their visits were 30% of the running costs of these hospitals. Another 2009 study revealed 9 patients visited the emergency room of a Texan hospital 2,678 times. Their visits cost the hospital $3 million. Medical zebra. In 1978, Dr. Steve Bergman released his novel, The House of God, which he wrote under the pseudonym Samuel Shem. The book is about a medical intern in his first year of internship and is based on his real-life experience at the time he was an intern at Beth Israel Hospital, Boston. Between 1973 and 1974, in the book, Dr. Bergman revealed some slang used by doctors. One is gomer, which means get out of my emergency room. Gomer is often used for an elderly patient at the brink of death. They are barely alive, cannot perform basic human functions and cannot be saved by medical care. However, they do not die and often go in and out of emergency rooms. Dr. Bergman also revealed other medical slang like turfing, which refers to the act of referring or transferring a patient to another service. This new service could be another hospital, a nursing home, the patient's home, or even a morgue. A physician who refuses to admit a patient or turfs them to another service even before they are admitted is called a wall. There is also the sieve. Who is a doctor that only accepts a few patients even though they could admit more? These sort of doctors are often considered a problem. A bounce or bounce back is used to refer to a patient that is readmitted. Another is lol in nad, which means little old lady in no apparent distress. Normal for Norfolk. Normal for Norfolk, or N4N, is a slang for a weird person. It started off as a medical phrase for a patient who cannot correctly describe the symptoms of their ailment or is just odd in some other way. It was also used to refer to a patient from a rural area. We know the slang is named after Norfolk County in Britain even though its origin is uncertain. One source says doctors at Norfolk and Norwich University Hospital created the phrase to refer to mentally retarded patients. Another source indicates the phrase was created by doctors outside Norfolk over concerns that people there have weird characteristics. Weird news reports from Norfolk probably reinforced this stereotype. Once upon a time, news agencies reported that police in Great Yarmouth, Norfolk, detained a driver carrying a wardrobe on top of his car. The wardrobe was only secured on the car with a bubble wrap. Other news reported that Norfolk farmers were hiring humans as scarecrows. Perhaps one of our British readers can shed some light on this in the comments. The daughter from California. He daughter from California or son from California in the case of men is a medical term for a person who suddenly arrives at a hospital and demands physicians perform some medical procedures to save the life of a dying relative. Some physicians sometimes swap California with New York. The daughter from California is usually angry and pisses the medical staff off. They refuse treatment suggestions, even from fellow relatives, and will continue to force their suggestions on everyone. Physicians consider their actions a syndrome they call daughter from California syndrome. The daughter from California is often a distant relative that has not seen the dying relative in a while. So they are often surprised with how bad the situation has deteriorated. Physicians believe the guilt feelings of being away from the sick relative is often responsible for the behavior of the daughter from California.